Hello, I'm Joy Dooling, Executive Director of the Central Illinois Health Information Exchange, known as CIHIE. We have seen tremendous growth from 11 charter members in 2011 to 34 members today. Our first full year of sharing data among members means that we are seeing real-world results when clinicians use the exchange for their work with patients. We're solving the kinds of problems patients have been telling us about since 2009.
Not only do you spend a lot of time chasing your tail trying to get the right people to send the right thing, but then, if you do go to a new provider, you have to start all over. So instead of what could be, a 20-minute appointment, you now have to schedule 2 hours to start from the beginning and go through everything all over again.
As I'd call and they'd say, no, I can't send you the medical records. Well, could you, why can't you send me something? Or there was a place where I could get them, but it was almost $1 a page for the first 25 and then 60 cents a page for the next 25. I was like, wow, it is hard to get medical records.
One of the significant advantages we have seen with the adoption of Health Information Exchange in Central Illinois is better access to health records.
When the doctor's office was closed or the services in a hospital were closed, medical records to get charts and that sort of thing, you couldn't do business until they were open again. This lets us be open all the time. Doctors can access the Health Information Exchange, they can access all charts, they can do business anytime. So it makes it better for the patient because you don't have to wait to get the care that you need.
There was that time where the hospitals, it was their data, it was our data, and heaven forbid we share it. That mindset has changed completely. We have to share this data. We have to get it out there for the public, for the physicians especially, to be able to make proper care for their patients.
I think it's a valuable asset to our arsenal, if you will, in how we administer care on a day-to-day basis. What I see this doing is adding the pieces to the puzzle that help complete a medical record for any individual.
I think it's a community benefit having HIE available with all of the facilities in our area between nursing homes and hospitals and physicians being able to access a record. I think that that's going to give a better patient experience for patients.
CIHIE's technology that makes it possible for clinicians to look up patient medical records is called All Charts.
I think for the patient, they really want to know that their care is coordinated and that physicians are communicating and collaborating. So from a patient coordination standpoint, the HIE really provides one place where a physician or care provider can go and find vital information. Before, you could get the information, but it was quite a struggle. So you might have 2 to 3 phone calls, you may wait 15 to 20 minutes for a fax to come back, and that was if you were lucky. You'd get the fax back, and sometimes you didn't before the patient had to leave. And now I have a place where I know I can look immediately and electronically.
It's easily accessible. It's something that you can keep up on your system. It's on the desktop in our emergency department for our charge nurses to view. It's easy to navigate through. It's something that makes us more efficient as a facility. We don't have to fax records to another facility and wait for we don't have to fax the consent to another facility. It's something that we can directly access. We have it at our fingertips.
Actually, we had a patient that came in on the inpatient service who was delirious. So they had an acute event that caused them to have decreased mental function. They couldn't remember their medications. They barely really remembered what day it was. And it wasn't somebody that we had typically seen before. And we were able to actually query all charts and get a reasonably good medication list. We were able to get their allergies. And actually, we more than likely would have prescribed them a medication that they were allergic to had we not seen that in all charts.
We've seen diversity in the types of organizations that are joining CIHIE, We now have an emergency transport company that provides ambulance services, a durable medical equipment provider, and more specialty practices. We've expanded beyond the core communities of Peoria, Bloomington, and Decatur to add additional hospitals up the I-39 corridor. And thanks to a grant received from the state of Illinois, we were able to connect more than 30 long-term care facilities from across the region. This is cutting-edge work. Nationally, many eyes are focused on this project, and people are eager to see the results.
That if I had one place I could go, and if I knew that I was going to see, you know, this doctor, but this doctor over here had just done this particular lab test, but this guy's going to want to do it again, then I know I can go there and I can get the results, or he can go there and he can get the results, and I don't have to, he can have them before I even walk in the door. I'd sign up in a heartbeat.